Why are we going to make this digitally? One, it's more accurate. So we're using our design software, we're using extra scans, we're bringing in extra information. It's going to be a much more accurate end result compared to analog, where we're setting teeth in wax and we're guessing where things are. It's just not the same. And we can do 3D printed or milled temporaries, which we couldn't really do in the past. They can be reproduced. You can change the bite, the freeway, all of that before you make your final restoration. So we can use digital kind of as a stepping stone. Instead of making 2 final restorations or making 1 and then adjusting the occlusion 100 times, we can make a temporary. And then, of course, there's less chair time for you and the patient. There's no chairside conversions, which I can talk about another time. But there's a lot of ways we can use digital to harness more information and less time, essentially, but still having a really, really good end product. Like I said, more accuracy. So your final denture, you can actually mill them. I wouldn't print them at this point. We'll talk about that in a minute. But you can mill your final fixed denture. It's going to be a lot more accurate. You're not going to have any shrinking or warpage from cooking your acrylic. It's going to, like, you're milling it out of a puck. It's stationary. It's not moving. You have a beautiful final product. Fits right over your bar. Everything fits how it's supposed to. There's no adjusting. More accurate access holes for your prosthetic screws. For those of you here that have already made an implant denture, how many times have you drilled a hole through and it's in the wrong spot, and now you got this big gaping hole and you got to like pick another tooth or fill it with some acrylic? It's painful. It's terrible. I've done it. It's horrible. Let the mill cut it for you. This makes your life way easier. Let's design a denture. This is exciting.